Hello everyone, welcome to my channel. Today we are going to discuss about how to prepare for the INISS plastic surgery interview, which is stage 2. So many congratulations to all the participants who cleared the stage 1 exam. In my knowledge 109 people cleared the stage 1 exam. So now you will be having the stage 2, which is the interview part, which is conducted by AIMS New Delhi, and your interview will be most likely conducted on a Zoom call. And so today I'll be talking about what exactly this interview is about, how to prepare, and what are the things which you need to know. So first of all, they might ask you to prepare a PowerPoint presentation of like 7 to 8 slides, which will include the questions. They will give you the pre-formed questions like why do you want to do plastic surgery, what makes the plastic surgery interesting, how will you contribute to the field of plastic surgery, these kind of questions. So one thing from my side that please avoid saying cosmetic surgery in the plastic surgery part, that why do you want to the plastic surgery. Avoid saying cosmetic surgery, because as you all know plastic surgery is much more than just cosmetic surgery. So yeah, next we are so you are going to have multiple faculties taking your interviews in your Zoom call. One faculty will appear and will ask about the questions of the related stream, and then you will wait for some time, sometime even 1 or 2 hours as well, and then the second faculty will appear, and so on. Around 7 to 8 faculties will take your interview. So they will ask according to their streams what they are asked to prepare for. So these are the major streams which you need to prepare. So one is burn reconstruction, everything about the burn reconstruction. For example, they might ask you about the sequence of the reconstruction part. In a case of complex post burn contracture, how will you reconstruct, which part you will reconstruct first, and principles of burn reconstructions, these kind of things. Every faculty will take interview for like 8 to 10 minutes, and they will ask you maybe 5 to 10 questions depending upon your response. And another stream is trauma, which is very important. They can ask you about the classifications of the long bone trauma, for example, Gustilo and Anderson classifications, trauma reconstructions, particularly lower extremity reconstructions, flaps related to these. And so you need to work upon your basics, that is anatomy part, which is very important because they will start their questions from the basics like anatomy of the part, and then they will proceed to the advanced reconstruction. So you need to know that first thing is anatomy is very important. Please brush up your anatomy one more time before you appear for the interview. And third stream is which is pediatric plastic surgery. Most likely the question related to cleft lip and cleft palate, the principles involved, different classifications. So what I want to emphasize that just revise your notes very briefly, that you should know the principles and the name of the reconstruction, flap name and the blood supply, these kind of things. And another very important part is breast. Again, starting with the anatomy of the breast, and then again which kind of flaps we can use for the reconstruction, what are the blood supply of the flaps, and different types of reconstructive options, oncoplastic reconstruction, etc. Another stream is hand surgery, which is very important. Again, the anatomy part, sorry guys, anatomy part, and then the hand injury, different type of ligaments in the hand, this is very important. And another stream is microvascular reconstruction, and they might ask you not just the principles of the micro reconstructions but also the little bit detailing of the reconstruction. For example, nerve reconstructions, what are the principles to follow for the nerve reconstructions, vascular anastomosis, different kind of reconstructions they might ask you. And they sometimes they even expect you from that whether you have observed, either observed or performed different type of reconstruction in your senior residency, or any of the post general surgery residency work you have done? Have you observed or performed or assisted? These kind of things. So, in my opinion, the interview will last like for every faculty, it will take like 8 to 10 minutes, and 6 to 7 faculties. So, around 1 hour of the interview, but it will not just get finished in 1 hour. One faculty will come and another faculty will come after some time. So, it might last a long. So, be prepared accordingly, dress smartly, speak confidently, and this time interview is very important because out of 109 candidates, I think the seats available which are less than 30, so one in the 3 or 4 person will get selected. So interview is very important this time. Be confident, and you will do well. So all the very best, guys. If you want to know anything else related to the INISS plastic surgery, you can follow us on INISS Plastic Surgery Telegram channel, and drop your query related to exam. Thank you, guys.